Hey everybody, I'm back for my second video. I'm still very new at this. We are in Alabama for a couple of months, so I don't have any of my normal things. The lighting is terrible. So anyway, my girl's asleep, my little daughter is asleep, so I'm trying to do this in between. Okay, today's topic is something that I'm so excited to finally get to talk to you guys about because it's in my specialty. It's my bread and butter of urology and women's health. So here we go. Today's topic is female stress incontinence. I want to help you quit peeing your pants, ladies. I'm your lady to help you do that. So, before we even start, I want to tell all of my listeners out there, all my readers out there, all the people watching this, women leak. Newsflash. I mean, it's a revelation. Women pee their pants sometimes. It happens. It's not uncommon. It happens to millions of women across America. Don't feel nervous about it. Don't feel sad about it. Don't feel like you're the only person on planet Earth that's ever had a leaking problem, because newsflash, you're not. Sorry, someone's calling me. Newsflash, you're not the only person to ever have peed their pants, especially for women who are a little older, who have had babies, who have had heavy big babies, 9+ pounds, women who have had multiple pregnancies. This is not uncommon. Even for women who haven't had those things, the pelvic floor is a set of muscles that gets unstable. So this happens. Don't feel embarrassed about it. Let's just fix it and talk about it. It's common, but it is not normal. It's not a normal part of aging. Common, yes. Normal, no. So your provider can work with you to fix it, and that's what I'm here to do, is to help you talk with your provider and figure out the right things to help get you on the path of not peeing your pants anymore. So let's talk about your pelvic floor. Your pelvic floor, I need to adjust my camera, is like a hammock. So it looks like this inside of your pelvis, okay? It's a hammock for a lot of structures within your vagina, including your uterus and your bladder. So we're going to focus on the bladder end of it, okay? So it holds up your bladder nice and tight and high. Over time, those muscles, and maybe it's just the way you were born, those muscles have some laxity and they're loose, whether it's weight gain, pregnancies, age, so on and so forth. Those muscles just start to loosen, and everything that used to be nice and tight is now starting to become loose and not fixated. Your bladder neck is a structure where the urine has to go over to get out, is a structure that's held really fixed in that pelvic floor. As that starts to wiggle and women cough and sneeze and laugh, then pee comes out. So there's several different kinds of leaking for women. There's, urge incontinence, gotta go, and then you leak because you can't quite make it to the bathroom. Usually with that is urinary frequency, going to the bathroom more than 8 times a day. And then there's stress incontinence, which is the one we're talking about now, which is coughing with maneuvers that place any kind of pressure of the bladder. So coughing and you leak, sneezing and you leak, laughing and you leak, you go jump on the tramp with your kids and you leak, you go running on the treadmill and you leak. That is called female stress incontinence. If that's what you have, this is the video for you. So there are a couple things that you can do to help yourself recover from female stress incontinence. The first one that you hear about all the time, and it's one that I talked about on my Instagram account, is Kegel Exercises. These are exercises for the pelvic floor. The pelvic floor gets neglected. Everyone neglects the pelvic floor. We're so concerned about our abs and our biceps and our thighs and our butt and lunges and all of these things. We forget to strengthen our pelvic floor. Kegel exercises are not just for stress incontinence repair or prevention. They're also for an improvement of your sex life. They can tighten the vagina, especially after giving birth. The vagina just isn't the same as it used to be. And as you age, those tissues change, and the vaginal tissues are just not what they used to be. Kegel exercises pull and tighten in those muscles to hopefully help build them up so that your pelvic floor is tighter. Kegels are very great for prevention. So all my women who are in their 20s and 30s, my young moms who are still going to continue to have children, please start doing your Kegel exercises. It's never too late to start doing those. So please start doing those. If you want to know how to do those, I have a diagram on my Instagram account at Here's to Healthy Women. So HERES to Healthy Women. Here's to healthy women. And it's a picture of a jellyfish being sucked up inside of the woman's abdomen and abdominal cavity, just that visual image of trying to suck a jellyfish up into your vagina. I know it sounds weird, I know it's crazy, but if you do it and you visualize it, it works. That diagram talks about how often you should do it, a few more tips about how to do them correctly, because most of the time women aren't doing Kegels correctly and they quit doing them. That's why Kegels fail. So if you're wondering how to perform a Kegel, please see my Instagram diagram. It's a great one. Now, the problem with Kegels is that usually by the time a woman is actively leaking, if it's just a mild case, if you're just barely starting to notice a few drips here or there, Kegels may be effective for you, and you should give those a shot first and let the muscles build up over 6 to 8 weeks and to see if you see an improvement. If you don't, we can try something different, but the Kegels would be a great place for you to start. If you have moderate to severe leaking with stress incontinence maneuvers, Kegels probably aren't going to cut it for you, and we need to move on to something different. The options really from that point on there are 3 real options. When you go into your provider, whoever you're seeing for this, your urologist, your primary care, your OB, whoever you're initially seeing for this, probably the specialist by the time they're doing this exam, but when they do a pelvic exam, they're going to check and make sure things haven't fallen, that you don't have a cystocele where the bladder has fallen into the vagina, you don't have a prolapsed uterus where the uterus has fallen down in through the vagina. As long as those things aren't occurring, they're just going to make sure everything is in its right place, and then they'll probably do what's called a Q-tip test, which is a test done with there's a little tiny thin metal wire, and there's some cotton at the end of it, little tiny, it's like a mini Q-tip. And they'll place this up inside of the urethra. You'll feel a little pinch for just a minute, and then they'll have you bear down to see what kind of degree of change that Q-tip is doing. So here's where it starts out. When you bear down, if that Q-tip does this, you have a great deal of hypermobility. That's a very important thing to know because it determines what kind of repair you will need, if you have hypermobility or if you don't. Far and above, more commonly, women do have hypermobility of the bladder neck. That's much more common. But you want to make sure that they're doing that before they proceed to do any kind of surgical repair, okay? So if you do have hypermobility of the urethra with positive stress incontinence, you will probably be getting something called a bladder sling. This is the only surgical repair is a tiny piece of mesh about this long and, this wide, just a very, very, very small piece of mesh. Polypropylene is what we use in my practice with my surgical group. And that is placed underneath the bladder neck to lift the bladder neck, and then it's fixated on the wall of your abdomen to keep the bladder neck fixed so that it no longer is mobile, so that when you cough and sneeze and laugh, instead of that urine just spilling over, it's fixated, and now there's a little bit of a hump for the urine to get over. That's a surgical repair. It's typically a same-day surgery. You can stay overnight, but it's a 23-hour stay. It's a same-day surgery. It's a 6-week recovery time period. People do very well with it. The people who shouldn't have this surgery are, 1, people who do not have hypermobility. I can't tell you how many times I see patients that have been seen by someone that didn't know what they were doing, that wasn't a specialist, and they suggested that the person get a bladder sling when they didn't have hypermobility. Did they have stress incontinence? Yes. Did they have hypermobility? No, they were never checked for that. So of course they're having issues now because they had a sling placed when they shouldn't have. You can have stress incontinence leaking and also have issues with other problems like a deficient sphincter, which is a circular amount of muscle that keeps the urine from just leaking out. Sometimes that sphincter isn't tight enough and it needs to be bulked with some coaptide injections. Now, to determine that, the Q-tip test is 1. If there's no hypermobility, then you should have some further testing like a CMG or urodynamic testing to determine if your sphincter is incompetent. So that's really important. The Q-tip test is very important here. So the bladder sling. Now, other people who aren't candidates for a bladder sling are women who are young and still going to be getting pregnant and having children. I would not suggest you have the bladder sling until you are done with pregnancies. Every pregnancy changes the pelvic floor and the way things are, and it shifts things around, so I wouldn't recommend you having that done if you're going to continue to have babies. So if that isn't an option for you and Kegels aren't cutting it, the only other FDA-approved treatment for stress incontinence, female stress incontinence, is something called an in-tone device, which I have here. I'm going to pull this out, and I don't want anyone to be alarmed because it looks suspicious, but it isn't. It's not what you think that it is. So this is the intone. Get your minds out of the gutter because it's not what it appears to be. This is a device used to strengthen the pelvic floor muscles further than what a Kegel can do. There's an electrode here. This pad is a metal strip, and this is an electrode that sends stimulation, so it's called a neuromodulator. This is neuromodulation therapy. The idea is you put this inside of the vagina. There's some gel that you use here to help the conduction go. You squeeze the bottom here, and it fills up. You see how that's getting fuller? Okay, so this should fill the vagina. These little metal plates should touch either the top or bottom or the sides, whichever one is more comfortable to you. And the vagina, it should slide into about here, middle of part of that bulb. I don't know if you can see that, but to the mid part of the bulb. To release it at the end of your treatment, you just push this button and the air comes down. But we'll keep this up, and then there's this little remote, and you turn it on, and this British woman comes on and walks you through your pelvic floor exercises. Basically, you're going to do a 12-minute, 6 days a week exercise for your pelvic floor. You put this inside of the vagina, you do Kegels on your own, and then this machine will actually do a stimulation to the muscles for you. You'll feel your pelvic floor muscles contract without you doing anything. Kind of like those ab machines that you used to put on that tighten your ab muscles. I don't know if you guys all remember that, but this is sort of like that. You put this in, it tightens those pelvic floor muscles, and then you'll do it with the machine. So you'll do it on your own. It'll walk you through and tell you, how hard you're doing them, what your strength is at, and how long you should hold it. And then after you're done, it will do its part, and you'll feel your pelvic floor contracting without you doing any work. And then at the end, you'll do it together. Like I said, it's 12 minutes a day, 6 days a week. This is used, that's the only non-surgical approach to treatment of hypermobility of a bladder neck with stress incontinence. And it also has other benefits like tightening up the vaginal floor, like I mentioned. One of the common things I have patients come in for is there any way that I can tighten my vaginal floor? It's different. Intercourse isn't what it used to be. What can I do about it? This is what I recommend, that they try and start strengthening all of their muscles and getting all of that nice and tight and back to the place it used to be before they pushed an 8 or 9 pound baby out of it, right? So that's my recommendation. This is called Intone. That's the company, is Intone Medical. There's a couple different kinds of devices. The one that you do not need a prescription for is called the Apex device. It can be found on their website, incontrolmedical.com, I believe is the website. I'm not getting paid to say any of this. This is what I recommend to my patients. This is what we use. This is what OBGYNs and urologists all across the country recommend because it's working. It's a newer product. There didn't used to be anything else available, but now we have this, so it's worth a shot. It's worth trying this. If you don't want surgery, you're not a good candidate for surgery, this is something to try. The Apex is the one that does not require a prescription. So the Apex device you can get just by going to their website and ordering it. I think it's around $200. I'm not 100% sure if that's accurate, but somewhere around $200, and it's yours. You get to keep it. And you use it 6 days a week. You clean it off after each use, and people have really enjoyed it. It's helped a lot of women. So I wanted to mention that and bring that up so that you guys know that that's available to you. That is the end of this video. That is female stress incontinence. If you have any questions or concerns, please feel free to direct message me on my Instagram account. I'll put the links down below to my website and my Instagram account, and you're more than welcome to contact me with any kinds of questions, because when you go to your provider, I want you guys to be asking the right questions and know enough information to get the best treatment available for you. And that's it. So see you next time. Hope everyone's doing great. Bye.